Within this physical assessment tool, we will be looking at the functional reach test. This test determines how far an individual can reach forward without having to take a step. The data collected during this exam will give participants the information to see whether they are at the risk of falling. The necessary equipment needed to perform this exam includes a meter stick, a flat wall, and some tape. The participant must perform 2 practice trials and 1 actual trial where the data will be recorded. In order to start the exam, a client must place their feet hip-width apart while always keeping their heels in contact with the floor during the test. Once in position, the client will raise their arms straight out in front of them with their hand in a fist. The meter stick will be placed along the wall parallel to the arm. We will record the position of the metacarpophalangeal joint before the exam begins in order to know how far the participant can reach in front of them. Start the exam by asking the subject whether or not they can maintain this position without pain. You are now going to place your arm in a parallel with the meter stick while keeping your hand in a fist position. During the exam, you are not allowed to touch the wall or the meter stick. When you are ready, please reach forward as far as you can without needing to take a step. If at any time you feel as though you are going to fall, do not continue to reach forward. Once you are confident that you cannot reach any further, I will read the measurement of where your knuckles end, and this will conclude the exam.
If the participant cannot reach more than 6 inches in front of them, then they are considered at a high fall risk. If the reach is between 6 and 10 inches, then they are at a moderate fall risk. Low risk includes having a reach greater than 10 inches. During the functional reach test, the examiner must observe the patient to see if they lose balance, felt wobbly, or cannot keep their hand at the height of the ruler. These could indicate other issues which would be improved with an exercise prescription.